All right. Well, good afternoon, everyone. Afternoon, I guess, for our East Coast folks, and morning for everyone else. I know we have a few folks from Houston and South Carolina and everywhere else in between. So I'll say both good afternoon and good morning. Brandon Gare with the National Minority Quality Forum. As you know, this is the last Friday in June. Ashley and I were speaking earlier, and we just kind of both realized, oh, July's next week or this week. But we're glad to have you here. We're going to talk about men's health. It's also the last Friday of the month, so this program is being brought to you by the National Minority Quality Forum's SHC division. And so I want to thank Leslie and Chinny for helping to put this together. I'm going to start off by introducing a gentleman that just seems to have either no time or all the time in the world, a physician, pharmacist, and business leader, Dr. Richard Harris. He's going to lead today's program on men's health. We sent his bio earlier with this, but you know that he's a physician pharmacist. He and an MBA, as I mentioned. He has a client-centric focus on how he leads healthcare. And so without further ado, I'm just going to turn it over to Dr. Harris.
Thank you so much for that warm introduction. And thank you to my other panelists, Dr. Bowens and Mr. Young, for being here to discuss something that's very important. So before we dive in and I ask my other esteemed panelists some questions, I just want to give some statistics so we know kind of where we are here in America. Right now, we spend about $13,000 per person on healthcare. And overall, we spend about 20% of our gross domestic product on healthcare. So it's about 1 in every $5 that transacts in America is on healthcare. Now, these are some startling numbers I'm about to present. This is actually based upon a study that was published this month. If you look at 2022 numbers, there's about 35 million Black Americans. And right now, based on 2020 numbers, 60% of Black American adults have hypertension. That number is projected to increase to 70% by 2050. 20% of Black American adults have diabetes. That's projected to increase to 30%. So you say 10%, that's not a lot, but think about it. There's 35 million of us. That's 3.5 million additional people with diabetes. That's a lot of people. Obesity is projected to increase from 50% to 65%, and total cardiovascular disease and stroke incidence from 12% to 16%. What's even more alarming is childhood rates of obesity are projected to increase from 25% to 35%. A lot of this can be driven by inadequate physical activity and poor diet. Those numbers are 55% and 60%. In children and adults, it's 50% get inadequate sleep, 35% have inadequate physical activity, 60% have poor diet, and those are 2020 numbers. And then you can look at things specific to men. 37% of all cancer incidents in Black men is prostate cancer. Prostate cancer is about 70% more likely to occur in Black men, and we are about twice as likely to die from prostate cancer as other minority groups. So these are some really important statistics on health. I'm hoping that we carry these conversations forward and continue to do something about this. Get people involved in actual preventative healthcare. So on that line, I'll bring in my esteemed panelists here. I'll start with you, Dr. Bowens. We've discussed before how I believe the church can be more involved and active in promoting health and wellness. So I'd like you to discuss about that, what you believe the church can be doing to help with our physical, in addition to our spiritual health, and maybe some things that you're doing and seeing in your community.
Well, again, thank you so much for having me on. And I'm not accustomed to being on doing all of this talking about the health because I have great people that handle that for me. And I'm very, very thankful and very grateful. But that does not leave me not knowing and not being knowledgeable of what's going on. So we do our best here at Trinity to really, really be a great advocate for our men. It's something that I'm certainly high on. But let me also say this. I have to throw this in. I was talking to my people early today, and that one of the things I want to always remind you that sometimes folks get upset at us, the church. Now, the church can't do everything. I want to make sure that that's something that's truly important for you to remember that. And most folks put that burden on the church of doing everything. The church has so many hats to wear. And I've often said to Trinity people, now we're going to do the best we can with all we can and what God has given us. But I just wanted to throw that in, to maybe look out for the church. And sometimes the church gets a bad rap, and because they're trying to do so many things, and they don't have the people to do that, or the professionals, or the knowledge, or whatever that may be. But I can only speak for Trinity right now, and we're trying our best. This is a major thing for us at the Trinity Baptist Church. Three different areas that we're focusing on. That is, certainly as it pertains to men, we deal with a lot of all people, but certainly as our men, and that is their physical health, their mental health, and their spiritual health. Those are the three areas that I'm real high on: mental, physical, and spiritual. And let me say this quickly about spiritual, and that is the Bible tells us very, very plainly that so does a man speaketh, so is he. And so we got to kind of change that mindset as it pertains to taking care of themselves and getting the proper need and all that goes with that. And so we have these big events throughout the year trying to get men to understand just how important they are to their families, which is first and foremost, to the community, and definitely to the church. That is extremely, extremely important. That and certainly I'm going to throw this in, and because the Black man himself always felt that he was not important in any aspect of life, and so many times that can happen, and then that cheapens who he really is. And so we want our men, not just Black men, but I wanted to throw that in because most Black men don't go to the doctor, and there are several reasons I can tell you about that. But I'm going to do what you told me to do right now, just to kind of let you know how we feel about it at Trinity. And so we want them to know that they are very, very important to us, because as men, the absence of the male, and certainly the Black male in the house, it changes everything, every dynamic about the possibilities of what can happen for that family and what will happen to that family when his presence is not there. And so we want them to have long lives, long, vibrant lives, and continue to live and do well and be able to have a major impact on their families, and again on their churches, and certainly in their community.
Thank you for that, and I completely agree. I believe as men that part of our role is to lead by example. And how can we be the best versions of ourselves when our health is lacking? We're not taking the time and investing into our own health and wellness. How can we expect to be able to handle the burdens that we have and provide for the people that count on us, be there for the people that count on us? And those investments into ourselves help everyone around us rise up and be more vocal and active in their communities. So I completely agree with you there. And I tend to look at things that same way, that you have to focus, do something daily for your spiritual health, for your physical health, and for your mental health, right? And we'll talk about that a little bit later. I tend to focus on the big five, and that's mindset, exercise, nutrition, stress management, and sleep. Those are really the big five of what is important to keep you healthy and wise, and help us out as we get older. Are you going to say something, Dr. Bones? You're muted.
I'm sorry, that big five. Can you repeat that big five? That was so important. What you just said, that big five again.
Yep, the big five is mindset, nutrition, exercise, stress management, and sleep. Those are really the premier things if you want to lessen the burden of a chronic disease or prevent a chronic disease. If you want to age gracefully, which that's what I want to do, I don't want to be in a situation where I have to have people take care of me. If sometimes that may be unavoidable, but if it happens, it's not because I didn't do my part to prevent it from happening, right? So those are the things that I really focus on in my practice. It looks like Mr. Young, you came off of mute. Is there something you want to say on this topic?
Yeah, only because listening to you, and good morning, good afternoon for everybody that's tuning in. Listening to you speak upon the numbers, it just made me think, we aren't sleeping, we aren't eating well, and we're not exercising. And that's and also not going to the doctors for our yearly checkups at a minimum. So that's what those numbers to me translate.
Mm-hmm. Yeah, yeah, you're right. I think it's, and I'm not 100% accurate on this, but I think it's something around only 30% of men actually go to that yearly physical, right? Just to get a checkup. And,
Yeah,
one of the problems is we're seeing that people, these disease states like obesity, like diabetes, like hypertension, they're silent. People can have very bad diabetes, very bad hypertension, very bad cholesterol and things like that, and feel absolutely nothing. And so they think, oh, because I feel fine, there's nothing going on, right? But
exactly.
unfortunately, and I wonder why God made us like this, that a lot of these really bad things are silent until it's too late, until there's significant damage being done. And that's why it's so important to get those screenings, just simple things, blood pressure, cholesterol, get your prostate checked, all right, the PSA level, to make sure that we don't wait too long to prevent these things from becoming catastrophic.
I mean, it goes towards education, just being able to, like you say, know and be able to identify what those signs look like. Having hypertension, having high blood pressure. Like if you don't, like you say, if we aren't bleeding, if we're not leaking, if we're not, feeling adverse effects, to make us say, man, I need to go see somebody right now because I can visually see something is wrong with me. If you don't have those things, like you say, it's not uncommon for most black and brown men to not go see a doctor because they don't or can't identify something is wrong with them. So, again, just speaking towards what that education is, I'm fortunate enough to, work with the University of Maryland Health and Wellness as a wellness warrior, right? So we do weekly trainings. We doing, information where we learning about, the signs of lupus. We learning about, if you have, uh, high blood pressure, to go get the checkups and stuff like that. So I'm able, to then, take it back to, the brothers that I deal with on a constant basis, just within my lodge, right? So then that opens the dialogue, that opens the conversation, because if it doesn't directly impact you or your family, I feel like not in so much it goes in one ear and out the other. It's like we become immune to, oh man, this brother passed away by high blood pressure. Uh, so if this person isn't again a direct affiliation with you, then you may not go and say, man, I need to go get checked up. So I think the more we talk about it, the more we able to educate people on, just looking out for the signs and to know like you can be feeling good, but still something can be going on underneath. I think that's gonna be one of the keys that we need to watch out for.
Yep, absolutely. And that brought us into the next question as a community, right? Because in medicine, we know a large portion of our health is our what we call social determinants of health. It's our environment. It's who's in your environment, what you do in your environment, what are you listening to, what are you talking about? All of that can play a dramatic role in our health. And so you just touched on this briefly. What can we do as a community to promote health and wellness, especially to our Black and brown brothers? I think it's very important. One of the things that you mentioned, to share your testimony, share your story, right?
Definitely.
Because we have to know that we all know people affected by these things, but they don't really tell us how it's affecting their life, right? We
Right.
tend to smile on and soldier on like our grandparents told us to, right? To fake it till you make it kind of attitude.
Yeah.
You're smiling in public and behind closed doors, you're hurting. Right. And
Right.
and you're not telling anybody, you know what, I'm really struggling with my blood pressure. It's giving me headaches. I'm getting blurry vision. I'm having chest pains, with my diabetes. My feet are numb. Doctors telling me I might need an amputation. To talk about these things, not in a way that, you're for seeking sympathy or things like that, but just so we can understand what's going on and understand that, whoa, this hits home if I see someone else going through this. So,
Yeah.
um,
Dr. Harris, I certainly would say that what you're saying is just extremely important. And that's why we try to do at Trinity. We try to have these men health summits, health initiatives, we try to have these particular ones, whatever we call them, we try to have them so that we can see other men being very open, being very vulnerable, to tell all of this, because men don't want to share certain aspects of their lives with other people, and certainly health is a major part of sharing. But when we can be transparent, we can, and certainly myself as a pastor, that's been probably my strongest suit, and the thing that also has hurt me a lot is that I'm very honest with you. I'll be upfront with you. I don't need to lie to you about myself or what's going on with someone else. We try to make sure we share these things, and so sharing, I think, has brought us a long way now. Because I didn't know my brother was going through this, or my sister was going through this, or whomever it may be. I didn't know this, but now that we're in the same area together and we're talking about it, I feel a little more comfortable in sharing it with other people now. And so these health forms that we give at Trinity, it's not only for our Trinity people, but for the entire community that comes out. And I would also say this: we're not, again, I'm not an expert at all in this area here. I'm just winging my way. Even through the day, I'm winging my way to talk to you about all of this kind of stuff, because I have other people that are much more knowledgeable than I am. I don't have to be the smartest man in the room. I just get smart people to take care of a whole lot of stuff for me, and that has been a key to my success. But what we also do is we get doctors, nurses, PAs, whomever it may be. We get them to come in on a whatever that subject matter is, and we try to find the best person to come in and speak on that. And so that's what we do. We don't do them ourselves. We're not out there talking to ourselves about things that a medical doctor should be talking about. We bring in the right person for the right reason, and hopefully that will connect with our men, that won't put them down. That's something I want to talk about fear. Now, I think this fear is bigger than you could ever realize, and I want to share this with you. But we don't want someone to put them down and make them more afraid. I was very, very afraid about getting a hip surgery. I'll say these two things here. Getting the hip surgery, and doctor, what was his doctor out of Thaddeus Bell helped me out. Dr. Thaddeus Bell sat me down and said, "Listen, you need to go ahead and get it." And I was so against having a foreign object in my body. I can't fathom this. You don't know how much it's working on me. He said, "Doc, it's gonna be all right. Go ahead and get it. You'll see." And let me tell you, 6 months later, it's been 8 months later, I feel like a new person now. And so I'm a strong advocate for this. Strong advocate, and for helping others who may be dealing with the same hip problem. Matter of fact, a young lady did have that problem, and she didn't know what to do. But because of my experience, I shared with her. She was willing and ready to go to the doctors and get that hip taken care of. And so that's what we got to be: strong advocates with each other in the community. We got to let them know that everybody's not out to hurt us. Everybody's not out to damage us. But then again, there's something I do want to talk about in that area when it comes to doctors and our trust, and certainly with the African American family. I wanted to say that piggybacking on what Brother Young, Dr. Young just talked about. I want to piggyback on that and just say a few words about it.
Thank you for that. And I'll come back to you, Mr. Young, in a minute. It looks like you got something to say, but I really think it's important. Two of the things that you just talked about. Number one, when you share your story, your testimony with other people, it helps other people hold you accountable, right? And that's important, because we need accountability. We need to be each other's keepers, and that it's really important to have the right people behind you and your goals. All right. One of the things that me and my wife do is we hold each other accountable. When she tells me that she wants to do something, she may not like me the entire time. But if I ask her, "Do you really want this?" And if she says yes, I say, "I'm going to hold you accountable to that. I'm going to make sure your actions, your words, your thought process are in line with what you just told me you want." But if she had never mentioned that to me, then I would never know. I would never know how to help her and how to direct her. And then the other component that you mentioned, fear. So many people are so afraid of coming to the doctor because they're afraid of hearing bad news. And let me tell you, don't be so concerned about the news, the things that you can't control. Control the things that you can control. You can control your mindset. You can control your exercise. You can control what you put on your fork. You can control what time you go to bed. You can control whether you pray or meditate or do yoga or do breathing exercises, something else to help you moderate your stress. So focus on that. Focus on the things that you can control. And don't let something that you know inside your body is telling you something is wrong. Something is wrong. Go get that checked out. Because the earlier we find things, we have had a lot of development in modern technology and diagnosis and things like that. The earlier we find something, the easier it is to treat. That's including whether it's cancer or high blood pressure or diabetes. There's actually a recent study that found that if the sooner we start getting someone's blood sugars normalized when they're diagnosed with diabetes, the more long-term complications we prevent. Right. So getting these things done early is extraordinarily important. And I just want to discuss really quick before I go back to Mr. Young, what screening should we do? Get that yearly physical done at a minimum, right? Go see your dentist every 6 months. That's extraordinarily important for health. Oral health is very important. Poor oral health has been linked to cardiovascular disease, cancer, diabetes, high blood pressure, chronic inflammation, Alzheimer's disease. All of these things are linked to poor oral health. So that get that cleaning done every 6 months. Make sure if you're above the age of 40, you get that PSA checked for the prostate cancer. We're starting to see prostate cancer in younger and younger men and more advanced prostate cancer. If you're above the age of 40 and cardiovascular disease runs in your family, talk to your doctor about screening for cardiovascular disease. You know, if you've had heart attacks and strokes, make sure you get those blood lipids checked, get your blood sugars checked. You know, that's something even if you don't want to go to the doctor, you can go buy a glucometer at Walgreens for 20 or 30 bucks. Check it on your own. And you can look up what your numbers are supposed to be. Same thing with blood pressure. You don't want to go to the doctor? Okay, go buy a blood pressure cuff or check it at Walgreens or Walmart. You know, and you can, and your resources like the AHA, like the American Diabetes Association, where you can see what those numbers are supposed to be. And there are other screening recommendations for colon cancer that starts at age 45. Some people are even recommending age 40, depending on family history. We're seeing more colon cancer in younger men as well. If you're a smoker, there's some screening recommendations for lung cancer to get screened based upon how long you've been smoking and what age you are. But those are basically the basics of screening recommendations for men. All right, Mr. Young, I'll kick it back over to you.
Oh, now, you both have had summarized pretty much what I was going to say, and that just was being intentional on knowing what your status is, and also you may not be as educated to know the language to be able to know what to look for, but again, if something is wrong with your body, you can feel it, right? If you got a headache, automatically we know, man, I'm gonna go to the medicine cabinet, I'm gonna try to get some Tylenol or something like that. So if things outside of those areas that you can readily identify, if something is making or giving you pain in some type of way, then what's the next best option but to go get it checked out. Just being intentional. Those were the two takeaways that I just got from what you both had just said and spoke on.
Thank you. Yeah, and one of the things I want to bring up that nobody is talking about loud enough, I think, and this is especially important for our young single men, is rates of STDs are going through the roof right now. I'm seeing it like crazy, and nationally we're seeing this in the data as well. So that's important for your overall health too, to make sure you get that screening. And I'm not talking HIV, I'm talking more gonorrhea, chlamydia, those types of things are syphilis is increasing a lot across the US. So making sure that, of course, you protect yourself. And number two, if you're sexually active, get screened. Encourage your partner to get screened. That's also very important for preventing long-term complications with, especially for women, fertility issues with untreated STDs. There can also be some very long-term issues with syphilis, heart and brain issues, nerve issues with that. And sometimes that can be asymptomatic after the initial rash. So these are things I highly recommend that people get screened for as well. And then that brings into another thing for the young men. HPV. So the HPV vaccine is approved for men. You know, at first it was just given to women for cervical cancer, but we're actually starting to see more people develop head and neck cancer from HPV than from the cervical cancer, because a lot of women have gotten vaccinated. So that's something to talk about, even up to age 40, I believe, is what the recommendations say. If you're interested in that protection, talk to your doctor about vaccination. Okay.
I can remember a time where we used to see like different infomercials about, STDs and, making sure that you have and protect yourself and stuff of that nature. We don't see those infomercials no more. And I kind of wonder why.
Mm-hmm. It's become kind of a taboo topic to discuss for some reason. But, you know, as physicians and as health leaders, that's something that can dramatically impact somebody's life. And so that's something that we need to not be afraid to discuss in the manner of screening, just like we discuss about all these other things that we've talked about today.
Exactly.
Okay. All right. So one of the things, you know, I like to impart is wisdom to the next generation, right? There are things that we all go through life that we wish that we had learned at a younger time period. And so one of the things I want to ask each of you gentlemen is, what's one aspect of health that you've learned that you wish you had learned at a younger age?
Let me certainly, I would love to join in on that one. As a young kid, as a young kid, I didn't get the health care that I needed to get as a young kid. Certainly, as a father with two children, now grown children, I made sure that they went to the dentist, and that they got their little yearly checkups. But I was very concerned about their health, because all the way around, concerning their health, because I didn't get that as a kid. I'm 60 years old. I'll be 61 in August. I hope the good Lord allow me to see it. But my point is, I grew up in the 60s. Came up, I think I saw a dentist one time in the third grade. And after that, in the African American community, you didn't see a dentist until your teeth were ready to, a tooth rather was ready to be taken out. And so it was a very scary thing also, going to the dentist, because it felt like a nightmare. But you had to go there, and the doctor, you don't know whether or not he was qualified or not, whether or not he had pliers in his hand, or had the right kind of equipment to pull it out, but it did. And so as a father, I wanted to make sure that my kids would get the best health care they could, from their mother and myself. Because of my experience, my wife's experience probably was a little better than mine. She had both parents in the home. My father died when I was just a little boy, and it's interesting that we talk about that. And I'm one that truly can, maybe sympathize and empathize with what's going on with with our health, as far as staying on top of it. My dad died at 27 years old with an aneurysm in his head. So, that was a very frightening thing. I can still remember the scene when he fell down on the floor, and all of that stuff has been in me. So I've always wanted to make sure that I took good care of myself, my wife, and certainly my children, because of all of these things playing in my life. I believe my father would have still been here, maybe if he had gotten better health care provided for him. Even as far as in the hospital, what hospital he went to versus maybe going to even one greater. All that plays a role. But again, that was he died in 72, so it was in 70 when all of this went down. And I was no more than about maybe 7, 8 years old as a kid, my brother and I. So that's heavy for me to make sure that, I think I heard in Reverend Henderson was talking about his on the youth channel just the other day when y'all was asking those questions. I went back over and read and listened to everything. And he was saying, I'm going to go to the doctor. That's one thing he's been on, going to the doctor. I'm there also. I'm going to go to the doctor, even though I may have some fears and some concerns. But I'm going to go to the doctor because of my past experience of not being able to go to a doctor, not knowing a doctor, not even knowing what my doctor name was. And so it's good now to give it. When someone say, "Well, who's your doctor? Who's your primary provider?" I can give those things out like like I'm giving out my last name or my first name because we have a relationship. I know them. But there are so many people that still today don't have that. They don't know the doctor. They don't have a primary physician. When they go to the doctor, they have to go to the emergency room or whatever. They don't have anyone to get good information from because that's not something that they are aware of when it comes to having a doctor in your yeah, especially thank you, especially in rural areas. And I come from a rural area. I'm in the city of Columbia now, and I've been here for 40 something years. But I grew up in a little small town where they got rid of all of the hospitals in my area, Bamberg and Barnwell. These are counties. Bamberg County lost their hospital. Barnwell lost their hospital. And that was a tragedy to that whole area because it would take you 30 to 40 minutes to get someone from an ambulance to a hospital, which would be Orangeburg now, Orangeburg County. And so I wanted to live in the city, so I knew that I would be close to. That doesn't mean I'm going to live, but if something would happen, I'm within minutes away from the hospital, and all that's based on my past experience. My wife, what do you want to live so close to the hospital? Well, I knew what I went through. I knew what I saw people went through as a child, and I dare not go through that myself. Doesn't mean that I'm going to live still yet, but it certainly gives me a fighting chance that I'm near a hospital and I know my doctors and all of that good stuff.
Mm-hmm. Mr. Young, is there something that you want to comment on this?
Yeah, I just was thinking about one of the first questions that you had posed to Mr. Bowens in terms of how we could get the church more involved, right? And his response was, the church can't do everything, right? And I was thinking he's right. And then I also was looking at it from a different perspective. It's not all on the church. The stats and stuff that, you just spoke upon, the general public, I can include myself. This is the first time I'm hearing about it, just the influx and the STDs and stuff of that nature, which then get me to start thinking it's got to be a part of the medical professionals' responsibility too, to take on and be more engaged with the public, not so much as wait for us to come to you, but we're going to need our physicians to be a little bit more intentional on coming out into the community and being more vocal about the things that are impacting our communities, and not just within the Black and brown communities, but in all. Because if we all in one community, then of course it affects us all, right? Mm-hmm. Those stats right there. So, I just was thinking about that. I can't say or talk enough about just being educated, being responsible, and then lastly, just the accessibility for the proper health care. When you think about, I want to say, a young person, maybe 21. Well, I can even go even younger than that. Let's say 16, working age, when they just started to hit the workforce. You're getting all this money that's being taken out your account, FICA and all this, and you're wondering as a young adult, like, where's this money going to? And it's going to quote unquote healthcare. A lot of people aren't in a position, I feel like, to pay out of pocket for healthcare. So that's why they don't buy into it, so to speak. That may be the reason why they don't go to the doctor. And I can use my brother as the number one example, because he has been having something on his arm and he refuses to go to a doctor because he doesn't have health insurance. He like, man, I ain't got time to pay for this bill. That's just more money. I got this to do. And I feel like that is the common denominator throughout the households in America within the Black and brown communities. Like, we're hustling, we're juggling so much day to day that healthcare, insurance, I don't need it right now, so I don't want an extra bill to be taken out of my check. I feel like they look at it like that. So again, if it's not something where, you know, our arm is broken and we need immediate care, like we just gonna push it to the side. So that's why, you know, those numbers continuously, I feel like, rise and get further and further, because if those symptoms aren't readily, you know, identifiable, they're not going to do nothing.
Mm-hmm. Yeah, there's a couple really key points that both of you gentlemen brought up that I want to jump on here. Number one is about duties. So you're speaking about what's the church's duty, what's my duty, what's the medical community's duty. And I 100% agree with you. That's one of the reasons I left mainstream medicine, was because I didn't feel like the medical community was doing enough in the community, right? We just looked at medicine like it's a doctor's office or it's a hospital. And it's not the community, which is completely backwards. It should start in the community and flow down from there to the office, to the hospital. And that's one of the reasons why I created like a free ebook. I'm on social media talking about this stuff, right? Because there's only so many people I can interact with one-on-one every single day, but I can get a message out there to thousands, right? I can create media and content around the stuff that we talked about today to try and help people. I think more doctors need to do that and not be afraid to do that. A lot of them are afraid to do that because they're worried about legal liability. And so, you know, there's some policy changes that we need there to make doctors feel more comfortable on a scale to do that, to disseminate information outside of the doctor's office. I think it's very important that people realize that doctors are people too. There are mean doctors. There are doctors who aren't very nice, right? If you get one of those doctors, don't take it as that the entire medical community is like that. The great thing is you can go see someone else. You can go get a second opinion. And I highly encourage people to get second opinions all the time. Trust your gut. If you feel like the doctor's not telling, like the information you got from your doctor is not sitting right for you, with you, trust your gut and go get a second opinion. There's nothing wrong with that. I encourage that all the time. Dr. Bowens talked about something earlier, and it made me relay this point. When you go to the physician or you go to any type of medical professional, bring a journal. Write down things in there. Write down things beforehand that you want to talk about. You know, we're talking about complex things, and people will come in there, and I know they're not going to remember everything I said. The studies show that they forget about 70% of what is said inside the visit within 24 hours. So I always encourage my patients when they come back, I'm like, bring something to write down, bring a journal, keep vigorous records. Don't depend on the system to keep your records. You have to keep track of your own, what's happened to you, how your body responded to certain things, because the doctor is going to need to know that to be able to help you better. If I don't have that information, then I'm just kind of basing it upon assumptions on what I think is going to help you. Healthcare expensive, yes. Healthcare can be very expensive, but there are ways now that you can find more affordable care. I think as telemedicine has grown, you know, a lot of these companies that offer telemedicine offer pretty affordable prices for a consultation. There are plenty of those companies out there. One of the initiatives that I'm actually involved with is, as Dr. Bowens mentioned earlier, rural areas is now we're seeing pharmacists be able to do these things. 93% of Americans live within 5 to 7 miles of a pharmacy. So having pharmacists able to take care of some of these situations, you know, blood pressure, diabetes, oh, you got a rash, right? Come in, see them, start on some treatment, and then refer out if necessary. So I think these are all things that can help with some of the things that you gentlemen have mentioned. And I think the biggest portion of healthcare expense is realizing that insurance is a risk pool, right? So when we put money in the pool, like we do with health auto insurance, we're counting on, okay, I submit money to this pool, so when I need it, something comes back for me, right? So with healthcare insurance, given the fact the numbers that I talked about, insurance keeps getting more expensive. Things keep getting more expensive because we're just utilizing more services all the time. And we have more people taking out of the pool than coming into the pool. And that's why I'm so big on, you have to be your biggest health advocate, right? you can't expect a doctor or anybody except God to work miracles if you're sleeping 3 hours a night, if you're smoking, a pack a day, if you're drinking every single day, if you're eating church's chicken 3 times a day, and the only exercise you get is you walking to and from your car. So we have to think that we are our own best asset, treat us like such, and have the system support us in that regard. Okay. We're about 20 minutes away. There are a couple questions here. I wanted to make time so we could answer some of these questions. What are some ways that we can make healthcare more equitable for men, especially those men who belong to minority communities? I think we've touched on this a lot during this talk. I think the most important thing is to just realize that a community is only as strong as its weakest member, right? So as we elevate all those members of the community, the entire community gets stronger. I think one of the things that we tend to think of is that our health only affects us, but that's not true. Your health affects your family members, your children, your parents. It affects your friends, your coworkers. Your health affects a lot of people around you. So thinking of health not only as well, it's my body, I can do whatever I want, but also as how does what I'm doing affect the people around me? And then how do the people around me, how can they help me achieve goals or to live a healthier life? I think that is part of what can help it be more equitable, is that we don't just put the burden on an individual, but we come together as a community to uplift and elevate and help each other. Anything else that you guys want to talk about on that subject about healthcare equity?
Now, definitely was in agreement with everything you just said. I was reading over some questions in the chat. I had been responding to them as well. But Chinny had just raised a great question that I wanted you to see if you could answer. She said, how can mental health awareness be promoted among men? And are there resources available for support, especially for the insured men?
Yeah, I think a part of it is being okay saying you're struggling, right? That you're hurting, that something's not right, and realizing that it's not something's wrong with you, right? We tend to think of mental health and physical health separate. I don't, because the same parameters that govern my brain govern my liver, right? So if I have something wrong with my liver, I wouldn't say, oh man, there's just something wrong with me. I'm abnormal. I'm different. I'm broken. You'd say, no, how do I fix this? What do I need to do? Like, give me some options. We need to look at the same with mental health. It's anchored in the same principles as our physical health. I think that one of the things that we need to do as men is not be afraid to talk about our emotions or our feelings. Now, I regularly tell the guys who are close to me that I love them, because I do. I don't have a brother, right? So my close circle of friends, my guy friend, they are my brothers, right? And so we wouldn't look at it abnormal if you told your brother that you love them. So why are we looking at it like our close male friends, that we're afraid to show them emotion and how much we care about them, and how much we need them in our lives? So I think part of that, being able to express these things in an open environment. And then as far as resources goes, there are a lot of online companies now, like Better Health, Talkspace is another one. We just don't have a lot of therapists, unfortunately. And these are two resources where you can download an app and start talking to somebody, right? You can also look in your community for therapists and psychologists that are available for cash, because insurance doesn't cover a lot of these things. And then you can look at building your own like meditation or mindfulness practice. So mindfulness has been shown to be as effective for anxiety as medication. Recent publications have shown that for mild or moderate depression, exercise is more powerful than medication. So, taking into account what you can do and then looking at these community resources, I think are things that you can do to help with your mental health. The system is still very hard for mental. We don't have great mental health support, I think, here compared to some other countries and some what we have for support for some other medical diseases. Dr. Bones, looks like you were going to say something there.
Yes, sir, Dr. Harris. I think very quickly, yes, mental health, mental illness, and seeking mental health has been just under the radar in this country. I remember in the 80s when a lot of these facilities were shut down in the middle 80s. Why I do not know, certainly in South Carolina, but there are so many of them are still needed. I don't know where we're going to go there because I was dealing with a young man in my hometown. I saw him with his shirt off and just absolutely in another world. And this was not drugs. And I immediately went to some of the townspeople, asked them who is this young man, and found out he was in my little community, and I know his people, and they said he needs help real bad. So we got to get him help. If not, this boy going to get shot. Somebody's going to shoot him. So no doubt, mental health and mental illness is a great matter. I want to say something very quickly about what you said about still getting it out. I think it still falls up under education in so many ways. Like, for example, telemedicine or telehealth. I know that's predicated on maybe whether or not someone has the technology or understanding, and that's what we try to do here at Trinity on Mondays. Mondays is our class. I can't think of the name of that particular class right now. I'm normally writing stuff down. We have a class where not just our seniors, but on Mondays, you can be at any age, you can come in and learn more about the computer basic class, just trying to navigate, learning the keys, all this kind of stuff. And because I want them to be able to get on my chart and all of that kind of stuff that they wouldn't know to get on or think about, or they would be afraid to get on. And they can look at all the information that that doctors have on them. So we want them to be enlightened. We want them to be knowledgeable. They know that, hey, we can do this. And that our church, and I agree with you, Brother Young, no doubt. And I say that with when I say that the church can't do it, and I truly do mean that. But I do know that the great burden is on us. We are a whole lot, but the church has always been the stable place in the community, and I think it's still the black man's, like the barbershop, so to speak. I think it's still the black person's little club where we come and we can talk and be honest with each other. So I know I can't get rid of that. I can't get from under that. We just got to carry a whole lot of the load, and Trinity is willing to do that. So I think we need to have these classes continue to further educate not only our males, but you said something, Dr. Harris, that was extremely important to me, because I said to you earlier that I'm like a fish out of water now dealing with my mom. My brother and I, we're just trying to hang in there. We don't know what we're trying to navigate through the system that we never ever dreamed that we'll be navigating through. And so I wish that she's 80 something years old, don't get me wrong, but that doesn't mean she has to have bad health at 80 something years old. So I'm saying to you what you just said, it makes a lot of sense, because that burden is going to fall on somebody in the family. Somebody in the family life will change because of somebody else in the family health got bad. If that makes sense, what I just said. And I'm seeing that right now like never before. And my mom she had 2 strokes. She had too many strokes, one on both sides of the brain. And we're doing everything we can. The doctors feel good about everything now. She's come a long way. I'm feeling good about it, but not that good to leave her by herself all the time. So I have family members that are now helping me out. She stayed with my wife and I for about close to 5 months, staying with us. But she was ready to go home. And then my doctor said to her, primary physician said, if you don't let the mother go home and give her a try, all you're gonna do is that's gonna kill her. She doesn't want to be there, and she's depressed. And if we don't get her out of this particular position, and but I'm scared to let her go because I know that she's about 40 something miles from me. So all of us got to play a role. My family members are helping me out in the country. Everyone is on board with helping, and I'm very grateful. I'm very thankful, but it takes a lot. No doubt, I know now what it takes a village to fix more than one person, but a village to lead people and to carry people. I'm seeing that like never before in my own experience. And so that's why I want to educate more. Maybe if we educate them more and more and more, then they will not end up in the position that most will sometimes end up in. I know that the body is deteriorating. It has to do it, but it's need to do in order for us to, on the spiritual side, to see the Lord one day. We have to die. But that's not an easy thing for people to talk about when it comes to that. Even death itself is a very, very hard thing, a very, very scary thing for people. And I want to say something about that. And I know we got a journey on, but certainly for men and Black men, um, they're afraid to die. I think we all are. I'm this great preacher. I love to preach. Well, I don't know how great I am, but I try to preach this great gospel. And I'm always trying to give folks help. But when death hits, it does something to you. I've been pastor for 27 years here at the Trinity Baptist Church, and I don't know how many funerals I've done, but I've had my share, and they have absolutely played their role on my life and made me think and just sometimes think too often about my own death. And so I'm saying to you, maybe in this sense, I wrote some things down that men are afraid in some sense of the doctor, because no doubt it connects bad news. It could be bad news for them, as we just said earlier, and they don't want to hear that bad news. And then certainly we talked about the doctor and his attitude towards them, and don't see them as human beings, or don't see them as being special people because they don't have the money. They don't have the kind of money that somebody else may have. He looks on their insurance and see that their insurance is absolutely. Listen, they wanted to put my mom out of the hospital when they discovered that she only had Medicare. She didn't have Medicaid, but she had Medicare. And, I knew none of this. I didn't check on my mama like I probably should have, see what her medication, not medication, but her insurance stuff were. I should have. She's always been so dominant in my life and never needed us for anything. And so when we had to take over, I discovered that she only had Medicare, and one of these social workers really just wanted me to know, listen, your mother getting out of this hospital about money. Yeah, I mean, she firmly said that to me in that sense. About money, she's out of this hospital, because she was saying to me she don't have the adequate insurance to stay here any longer. So, and that was a very hurting thing to hear someone think on that level, and talk to me on that level. And so certainly I did my own little talking to, because I know plenty senators and representatives in those areas, and because of my connection, I was able to talk to some people, and she stayed longer. But everyone will not get that opportunity to be able to stay in that hospital. So I think we got to educate them. And just what my brother said, Justin Young said about trying to make sure you help them understand that we got to get the right insurance. And if they can't, we got to figure out what's important. What is your health versus maybe, I don't know, getting food on the table. But there's a lot of decisions that got to be made in somebody's house on what they do with insurance. And this country has truly let us down when it comes to insurance and helping the poor people rather. I want to say one more thing, and is that I think that we got to help them discover relationships with primary physicians, and that they can see that all doctors are not bad doctors. And just as I'm listening to you, I mean, I can see your heart when you talk about love. You do the very same thing I do. I'm always telling people that I love them, and it means something to me. I don't have to be your best friend for me to tell you that I love you, but I want you to know that I care. I want to be a caring pastor. I didn't want to be a pastor that that I was above the people and beyond the people, but I'm just as with the people as can be. That's who I am. That's who God called me to care for people. That's what you do very, very well. I can feel it and see it in your heart that's what you do also. But there are so many people that don't do this. So many people are not like us. They don't really care. They're in a profession that maybe they should not be in. So I'm saying too that we got to help them find out they're good doctors, and that they can connect with those doctors, and those doctors will do that which is good for them, that which is best for them. All of those things that can happen, and we can do these. We can present these doctors. We can bring these doctors to our own community center that we have here. We call it TEC, Trinity Education Conference Community Center. It's adequate to handle everything, and so we can get those doctors here, and that they can and they can play their role. And that's what we're trying to do, connect with every source we can connect with. I mean, all throughout. People like Vivian and Darren Henderson, they are doing that for us. And the entire health ministry is doing it, but they are my core leaders. They are making sure that this get done, and we're going to do the best we can with all we can, while we can, as long as we can. But we're going to do it. If we don't do anything else, we're going to show people that we care. And I think that's what every profession should do, whether you're the barber, whether you are the painter, no matter what your job is, you're to show folks that you care. And I've always said this: people don't care what you know, they know how much you care. It's always been my quote. And this is what this is about this evening. Just talking to you is firing me back up again and keeping the fire going that we should care. And I truly do care, sir.
Well, thank you.
Hey,
Thank you, Dr. Bowens.
no passion.
Mr.
No,
Young, anything, we got a couple
I
minutes
just
left. Anything you want to say?
I just want to say, Dr. Bowens, man, your passion, man. I see it. I thought you was gonna close us out for a minute. But I seen something. I seen a question in the chat. Someone had posed and they said, you know, how can we get, I guess, men? I can't remember because so many questions pop back up now. But it said, how can we get men, I guess, to engage in more topics like this, or just to start the conversation? And I felt like the quickest answer is, you know, just to be direct. You know, just asking men, you know, what their status is. You know, when's the last time you went to get an STD check? When the last time you went for oral checkup, you know, a oral screening and stuff of that nature. So, you know, I'm very fortunate for the women that have been in my life because, you know, I was one of those guys that wasn't going to the doctor unless something was dramatically wrong with me. But, you know, it took a partner to say, hey, get your yearly checkup. Hey, go for this, go for that. So your community, your village is going to be your strongest advocate if you don't have, you know, that those other resources in terms of, you know, maybe financial resources to go to, you know, a patient first or whatever. I do believe, just like Dr. Harris said, there are other remedies that, you know, are accessible and available, but you won't know until you are at least vocal. That's the start. You got to be vocal. So until you had that conversation, you know, nothing would change.
Yeah, I would say this tomorrow. We're having our what is it? It's tomorrow. Well, the 29th. I think it's the 29th. We're having our men conference. Men United in Christ conference. But we're doing the Trinity is now is collaborating with what we call our Gethsemane Association. They wanted us to. They've seen how it has worked at Trinity, and we're not saying we're the best by any stretch of imagination now, but we have truly been genuine and transparent with everybody, men and so forth and so on. But they want us to run that ministry for them to help them grow their while we're in that same association, but they want to grow the men aspect of it, and they've asked me to help spearhead that, and I'm definitely I'm glad to do it. But I do it with genuineness. That's the point I'm trying to say, that people are tired of tricks. They're tired of gimmicks rather. They're tired of folks just using them as pawns, but they want you to be real with them. So I said to them that I would never get to in one of my men and lie to them or lie in their face, or do something that would just cause them to say, I don't want to do with the church anymore, whatever it may be. So we're hoping to have over 200 men tomorrow. We had 100 last quarter. I can't think, that last quarter was March or May. We had about 100 and something. We're hoping to get 200 at this particular meeting tomorrow. We'll have this three aspects. We're going to talk physically, mentally, and spiritually. Those are the three things we deal with, and we'll use a book that we're talking from. But mainly, we will have a conversation and get them to see. And I will share a lot of this tomorrow also. With them, to get them to see also how important health is. I will be talking a little bit more now about men health, even more than we've done. I truly understand how important it is. But I think that question that the person posed, that be honest with them, tell them we want to have a talk like you just said, and we're not trying to hurt you. We want to help you, and knowledge can be something great for all of us. The more we learn, the more we can help others.
Right. Well, we are actually at time. I appreciate everyone who made this this webinar today. Feel free to reach out to me or contact me if you have any questions. We did place my contact information there. So I'm happy to talk about health at any time. I want to thank Dr. Bowens and Mr. Young for being here today. Also for everything that y'all do in the community. Truly appreciate having leaders like y'all in my circle. So, all right. Well, I hope everyone has a blessed day, and we'll probably do this again sometime soon.
Love to. Appreciate it. Thank you.
Yeah, I agree with you. I loved it. I truly enjoyed it. Thank you so much, Dr. Harris. We truly enjoyed you. Brother Young, I truly enjoyed you. Thank you so much for allowing
Sir.
us to be a part of this.